In this video, we will take a closer look at the Coordinated Care Model, or CCM plans, offered through Moda Health. CCM plans use either the Synergy or Summit network. The Synergy network serves OEBB members who live and/or work in the western and central areas of Oregon. The Summit network serves OEBB members who live and/or work in eastern Oregon. In addition to having birch, cedar, dogwood, evergreen, and fir plans available, Moda also offers an alder plan as a CCM option. This plan has the lowest deductible and out-of-pocket maximum limit out of any of the Moda plans offered. The alder CCM plan also includes lower copayments for primary care, incentive care, and mental health office visits. This slide provides an overview of how coordinated care model plans differ from preferred provider organization plans. As we've previously mentioned, CCM plans are paired with either the Synergy or Summit network. Another key difference is that if you enroll on a CCM plan, you agree to have your primary care needs coordinated through a Moda medical home and to communicate that selection to Moda. I will discuss how to search and select a Moda medical home on an upcoming slide. PPO plans do not coordinate your primary care, and you do not need to select a Moda medical home. Our CCM plans connect your primary care with the rest of your care team, including other providers and specialists, to bring you and your family the best treatments facilitated through a medical home. Coordinating your primary care saves you money and creates better health outcomes. On CCM plans, you are able to see specialists and other provider types outside your medical home, the same way you would on a PPO plan. Please note that referrals are not required to see a specialist on either plan. However, if you are on a CCM plan, you will want to make sure that these providers are in the Synergy or Summit network in order to receive in-network benefits. CCM plans also include lower copays for prescriptions, and your pharmacy expenses accrue towards your medical out-of-pocket maximum. On the PPO plans, pharmacy expenses accrue towards the higher maximum cost share. All CCM plans require members to select a medical home and communicate that selection to Moda. A medical home is simply another term for a primary care clinic. Each member enrolled on the plan may choose a different medical home. The selection does not have to be the same for the entire family. You must use your medical home for all primary care services in order for benefits to pay at the in-network level. Primary care includes internal medicine, family medicine, general practice, geriatric medicine, and pediatrics. If you utilize primary care services at a clinic that is not your selected medical home, benefits will be paid at the out-of-network level. Keep in mind, obstetrics, gynecology, and women's health can be utilized outside of the medical home, but the provider must be in-network in order to receive in-network benefits. If you are thinking about switching to a CCM plan, use Moda's online provider directory, Find Care, to look and see what providers are in the Synergy or Summit network. If you are logged into your MyModa account, the results will only return providers that are in your current network. To search for providers in other networks, use the Search by Network option. This will allow you to search networks that you are not currently enrolled in. If you enroll in a CCM plan, you will receive a medical home selection guide along with your ID card. This will provide directions on how to select your medical home through your MyModa account. If you are currently enrolled on a CCM plan and have already picked a medical home, you will not have to do anything unless you want to change your medical home selection. After you enroll in a CCM plan, you'll want to make sure you pick your medical home as soon as possible. Please note that Moda will not have your 2018-2019 plan year enrollment selections updated in MyModa until mid-September. Once that information is updated, you will be able to log into your MyModa account and make your selection. The next few slides demonstrate how to select a medical home. Once you have logged into your MyModa account, you'll see a Medical Home tab on the top. There, you'll be able to select or change your medical home. You can search for a medical home by the facility or provider's name, and then select the miles within your zip code to find medical homes in your area. You may notice the medical home icon shows tier levels 1 through 5. This means the provider has been certified by the Oregon Patient-Centered Primary Care Home. Choosing a patient-centered primary care home means you will get the best possible care. The higher the tier, the better coordinated the care. Once you have selected your medical home, you will receive a confirmation at the top. You will also receive an email confirming your selection. We also want to remind you about Moda's customer service teams and that we have OEBB dedicated phone numbers and email. Customer service is available Monday through Friday from 7:30 a.m. to 5:30 p.m. Thank you for taking the time to learn more about Moda's CCM plans and the Synergy and Summit networks.